Welcome. My name is Scott Sherman, your Winona Mayor. Thank you for being here this morning to hear news and updates on the vaccine rollout in the city of Winona and Winona County. We'll hear from leaders with Winona County Public Health and Human Services, city and county emergency management, and our local healthcare providers, Winona Health and Gunderson. We'll also hear from community leaders on how they are responding, adapting, and changing when it comes to our small businesses, our schools and universities, our healthcare systems, our public safety and courts, as well as support and resources for mental health. This event with all the leaders and partners here today is a perfect example of how our community has come together during COVID. I've seen incredible collaboration these last 10 months, in some cases happening literally overnight. Winona's community institutions have a long history of working together, and that's never been the case, more so than it has during the pandemic. We have a long road ahead and a lot of questions that we can't answer yet, especially on how soon vaccines will be available to the general public. Those answers depend on decisions at the state and federal level in the coming months. I urge everyone to be patient and remain diligent. Know that everyone here today, including our media partners, are working hard to ensure updates are communicated quickly and accurately within the community. You'll hear a lot of hopeful news and updates from our community leaders and partners this morning. One thing you won't hear a lot about, not quite yet, is how Winona will rebuild, recover, and reimagine itself in a world after COVID. We'll be there soon. That's why I'm excited for the city's comprehensive planning process to begin later this year. This 2-year investment in bringing together the community will create a document and plan of action that will guide elected officials like myself, our city staff, and our whole community in the years and decades ahead. Planning is already underway, and I'll look forward to sharing more with you soon. On a personal note, from an outside perspective, I've been involved in these COVID discussions for now about 2 months. The response, the collaboration, the immediacy of the action that we are taking has been phenomenal. I am extremely impressed with not only our staff here at the city, our fire chief, our police chief, but also all the partners that you'll see today in our meeting. I want to personally thank all of you for helping us through this difficult time. Thank you again for being here today, and I'll turn it over to our leaders with Winona County to get it started. Thank you.
Thanks, Scott. Yeah, and Winona County folks can start. And I do want to signpost, we have a question in the chat on that says, will any local organizations offer vaccinations to the public? To whom, when, and how can people sign up? And I just wanted to bring that in early because I know that's part of what may be addressed for folks. So Winona County, and then the city folks can come next, and then our healthcare institutions.
All right. Thanks, Brian and Scott. I'm Ben Klinger. I'm the Emergency Management Director for Winona County. I've been working with our partners since the beginning of the COVID crisis, and right now focusing on planning for vaccine rollout. Winona County and all of our partners have taken a team approach to this. We've partnered with Public Health, Winona Health, City of Winona, Gunderson, and I'm sure some more people that I'm missing. We've been meeting regularly since October to plan for vaccine rollout, but our planning really started before that. We've been discussing it since the beginning of COVID. When we did the mass community testing, we took the information from that into our planning. And in the last month have really ramped up planning and distribution. We've been following the phased approach from MDH as we're required to do. So we're still in phase 1A, first and second priority. With that, we vaccinated our local emergency medical responders as medical responders and as the people who will be doing the vaccinations for us. And part of that was going out to the rural EMS to get them the vaccine, but to also practice our plans for when we roll out larger vaccination efforts. All of this has been really coordinated and really stepped to be able to phase up quickly as needed and to identify any issues quickly on a small scale, so we wouldn't have any issues when we get into larger vaccinations. We've done over 300 vaccinations of EMS and those partners in our community, and look forward to rolling it out on a bigger scale to more groups as it comes. Asking everybody to be patient. We're ready to go here locally. We're just in need of the vaccine. So you know, there will be no hang up when it gets to us. We've pledged to not let any vaccines sit. Our partners have pledged that. So we'll continue working through the phases to get the vaccine out quickly. Our plans are very flexible because we don't know right now the amount of vaccine we'll get at a time. So we can ramp up from small clinics to doing large community events if we start getting larger amounts of vaccine. But that's really the linchpin in our plan, is when we'll get the vaccine, not the planning itself. We're ready to go with our partners and want to get the vaccine out as quickly as we can. And I just want to thank all of our partners in the community for working with us on the vaccine. With that, I'll turn it over to Melanie Tachi, the Public Health Supervisor for Winona County.
Thank you, Ben, and thank you to all of our community partners who have made those closed COVID-19 clinics a success. As Ben said, I'm Melanie Taji. I'm the Winona County Health and Human Services Supervisor who oversees the Public Health Department. Winona County, as Ben mentioned, is following the Minnesota Department of Health's guidance to implement vaccine to phase 1A. And as soon as we can, as soon as we have the vaccine, we will move into vaccinating Winona County's over 65 population, pre-kindergarten through 12th grade school staff and childcare providers. We are currently in phase 1A second priority, which is assisted livings and home care agencies. And we will be moving in to provide the second doses for that first phase 1A first priority, which includes emergency medical personnel, COVID-19 testers, and COVID-19 vaccinators. After this, we'll be moving into phase 1A third priority, which is the remaining healthcare providers later this month, depending on vaccine availability. There is very limited supply of COVID-19 vaccine here in Minnesota. Despite what the federal government promises, we are still waiting to see increased vaccine and receive more guidance on what phase 1B will look like. As Ben mentioned, Winona County has a plan in place for when we receive that additional vaccine. We are ready to go, and our plan includes to continue with our partners to complete phase 1A and start hosting closed COVID-19 clinics in our community. And I'll speak to what those will look like in a moment. As for the current COVID-19 closed clinics, I do have some guidance for the individuals who reside in that population. So first, if your organization employs any of the workers listed in the Minnesota Department of Health's phase 1A guidance, which can be found on the Winona County COVID-19 response website or the Minnesota Department of Health website, please have a designated person complete the healthcare affiliation form available on the Winona County website. Once we have vaccine and it's available to your employees, a Winona County staff person will contact your organization to provide a registration link on how you and your team can be vaccinated. If you are a phase 1A employee, please contact your employer to inquire on how you will receive the vaccine. If you are over the age of 65, please contact your medical provider and ask about what the next steps are to receive your vaccine. If you are pre-kindergarten through 12th grade employee, the Minnesota Department of Education will be contacting the school district superintendents to talk about next steps about how you will be receiving the vaccine. And please, if you have already received your vaccine, please continue to adhere to the social distance guidelines, wear your face mask. This will help Winona County and Minnesota continue to combat this virus. So, community clinics. Let's talk about the state level. So starting on this Thursday, January 21st, 2021, the state of Minnesota, Minnesota Department of Health will be launching 9 pilot COVID-19 vaccine site clinics. These clinics will serve adults over the age of 65, pre-kindergarten through 12th grade, and school staff and childcare providers. These sites will be receiving a small number of doses eligible to all Minnesotans, and those pilot sites are located in the following counties: Otter Tail, St. Louis, Pennington, Stearns, Nicolay, Olmsted, Leon, Hennepin, and Anoka. As the Minnesota Department of Health provides more information about these sites, it will be posted on the Minnesota Department of Health website. As for Winona County closed clinics, Ben talked about what's currently going on, but as vaccine becomes readily available, Winona County will continue to host closed clinics throughout the county. We have received city administrator approval from Dakota, Rolling Stone, Winona, Goodview, Lewiston, and St. Charles to hold sites in their cities. We have also received approval from the universities to hold clinics at their sites and many of the schools that are located in Winona County. These clinics are going to look very similar to the flu clinics that we held in October, with some differences. And those differences include all appointments will be scheduled online. There will be no drive-through clinics. And as part of the COVID-19 protocol, we'll be asking everyone who receives the vaccine to be monitored for 15 minutes after they receive the vaccine. Once we have enough vaccine, like Ben mentioned, we will be moving to larger scale clinics and moving right along into phase 1B as we receive more guidance. Winona County will share information on our next steps and how we'll be implementing these vaccine clinics via a press release on our county's social media platform and on the Winona County COVID-19 response website. Also, starting next week, Winona County's 507-457-6500 phone line will have an additional option added to provide COVID-19 vaccination updates. So for example, when you call that number and are calling the county, there will be an option 8 to hear a pre-recorded statement about the COVID-19 vaccine updates. This is another resource for Winona County residents to use, but we do ask please to limit the number of calls you are placing with Winona County Public Health about vaccine ineligibility. We understand your concern about receiving the vaccine, but we ask you to remain patient as more vaccine becomes available and as we receive guidance from the federal and Minnesota Department of Health level. More information will be shared with the patients and Winona County residents as it becomes available on our county website and our social media platforms and via press releases. I sincerely thank you for your understanding as we go through all of this together. The vaccine is a light at the end of the tunnel, and just like we've done throughout this entire pandemic, we will get through this together. And so next, Karen Sanis from Winona County Health and Human Services.
Good morning, everybody. This is Karen. I'm Karen Sanis. I am the Health and Human Services Director for Winona County. Thank you, Melanie and Ben, for the very thorough updates you provided. And you guys probably took most of my talking points. So, so I just really want to extend my appreciation to everybody that has been part of this planning and the collaboration throughout the county to get this vaccine rollout to, through the entire county. We have done tons and tons of planning, last minute changes, sometimes overnight changes. This thing is very fluid and it continues to roll out. We are continuing to use the term, we're building the airplane as we're flying it. So things change very quickly and very rapidly. So we continue to work hard to adapt to those changes and roll out the vaccine. Continue to wear your mask, continue to social distance, continue to do your part in keeping everyone safe with the spread of COVID-19. We are at the federal level, we are worrying about bottlenecks within the distribution of the COVID-19 vaccine. So again, please be patient. We will get once we get the vaccine, we are prepared and ready to roll it out and get the vaccine out to the individuals in our communities. So again, I would just want to extend my appreciation to everybody that we have worked with between our schools, our medical facilities. Our county board has been so supportive of us and also our county administration. So I appreciate it, and I just really want to thank everyone.
Thanks, Karen, and thanks, Winona County folks. And I'll turn it over to our City of Winona officials for a few minutes, and then we'll go from there to Winona Health, and then from there to Gunderson. And just a quick note for media, I know we have full names listed on most of the speakers. The full names and titles were pretty much in the attachment that went out. But if you're looking for spelling, other kind of things, you can just put that in the chat. We'll make sure to get to you. So with that, I'll turn it over to Kurt and Joel with the Winona Fire Department.
Okay, thank you, Kurt Biddle. I'm the fire chief for the city of Winona and also the emergency manager. I'm going to start out with a quick little story, I think. The county hosts an emergency coordinating committee that has been meeting for years and years and years and years. We typically meet the last Tuesday of every month, and I dug around in the archives here, but this was for the meeting of February 25th last year. It was just a notice that we were going to have this meeting. An email was sent to the group, which basically includes everybody on this panel. And I just found this very interesting. The email was, in light of a possible pandemic occurring in the US, I was hoping we could bring relevant department SOPs and SOGs for the discussion and role play to the February 25th meeting. Looking forward to the discussion. So I find it very interesting that we've literally been working on this for almost a year, including everybody on the panel. I've been extremely proud of the city of Winona's efforts to combat COVID-19. A lot of that is boiling down to leadership from our former mayor, Mark Peterson. And Scott, I do have great hopes for you also, but also our city manager. The city of Winona was one of the first cities in the state to actually issue a mask ordinance. With the city manager's leadership, we developed a COVID-19 community response team, which basically consisted of city employees, and their sole focus was to look for best practices being exercised throughout not only the nation, but around the world, and incorporate that in the city's response plan. In addition, we also added Brian here, our communications director, which has been absolutely the linchpin to getting our messages out to the public. From the fire department standpoint, early on, we developed a mission statement relevant to COVID-19 response. These bullet points ranged from internal operations to as simple as disinfecting stations where you have buildings with 24-hour personnel living in. It was a challenge. Also, along those lines, one of those bullet points consisted of how are we going to keep businesses open, their employees safe, and their patrons safe. We've made a strong effort. Back in May of 2020, we began as a department assisting businesses with the development of their COVID-19 response plans, which was a needed state directive to open up businesses. We've assisted on site these businesses to open and taken numerous phone calls and helping develop that. August 20th, or in August of 2020, we began our bar and restaurant occupancy checks. And this was with the intent of doing everything under the sun to keep these businesses open and viable, along with their employees and patrons. October, we facilitated a public flu vaccination, and that was in coordination with County Health and Winona Health and our nursing students at Winona State. And we as a group, brought everyone together just as a dry run for any future COVID-19 vaccination, mass vaccinations. It was an eye opener. We had some very capable people running that. And it worked out well, and I think it's kind of the baseline for our county community planning committee to work off of. Like I said, we're working very, very closely with all our partners. We are basically the boots on the ground for the county health department, assisting with staffing and so forth as far as vaccinations go. And we are more than ready for this to be over with and done. And I'm looking forward to any questions anybody may have. So thank you.
Thanks, Kurt. And with that, we'll turn it over first to folks from Winona Health and then to Gunderson for about just a 3 or so minute update on what your institutions are doing.
Thank you, Brian. And again, I want to reiterate what everyone else has said, and thanks for just the collaboration, cooperation, working together during this pandemic time. I'm Sarah Gabrick, and I'm the Chief Operating Officer and Chief Nursing Officer here at Winona Health, and have been, because infection control falls under my auspice, I've had a very key role in this whole pandemic situation. So, as you've all been talking, I recall things like PPE shortages. Does anybody remember that? Unable to get supplies for testing. My goodness, it seems like it should be second nature, and it's just been very difficult, and now we're into the vaccination phase. We understand too here at Winona Health, like all of you, that people are really eager to get this vaccination. We are so looking forward to having more vaccination available and in our community. And Melanie, you did just a fabulous job of kind of creating that scenario that we're in right now, in that there just is such a lack of vaccine as a resource. Having the criteria expanded in the state is great, and vaccinating priority groups is really awesome as well. However, we are dependent on the vaccine really being here and in our hands in order to give it to our community. Winona Health will certainly continue to refer to the guidelines from the Minnesota Department of Health, and in determining the vaccine priorities, along with collaborating with our local partners in this vaccination rollout. At this time, Winona Health has vaccinated over 1,000 individuals. We have been using the Pfizer vaccine, which is what we received. And of course, there's lots of storage issues with that, and constraints and just logistics that we've certainly had to learn to work with, et cetera. But about 65% of our workforce now has received that vaccine. And we've also vaccinated our long-term care residents in Lake Winona Manor and our assisted living facilities and staff that work within them. Winona Health's vaccination process thus far here internally has gone very smoothly. Once additional vaccine is received, we will continue working with the county and the city on the vaccination plans and priorities to make sure that we're all in alignment with our coalition and our local partners. We're actively working right now with the county and the city on vaccination planning. And as Kurt said, this has been ongoing for quite some time already. And I do agree, Kurt, that the flu vaccination process was a good test really of our efforts thus far. And I think it proved out really well. And we can do this as a whole in our community. And by working together, we're definitely much stronger. Part of the process for this vaccination really is the logistics, though, around the storage, the timing, the post-vaccination observation, as Melanie alluded to, 15 minutes to stay after the vaccine and be observed, vaccination locations, and then there's also that whole second piece with timing of the second dose. Right now we are working with both types of vaccine. We had Moderna vaccine for our long-term care. We have Pfizer for everyone else. They have different requirements. One is 21 days to have that second dose. The other is 28 days. It's just making sure that all of those reminders and everything are on people's schedules so that they get their vaccine in their time frames, right? those who receive the vaccine, like those who do not, as you've already alluded to from the county and city, is, maintaining that masking and social distancing protocols. It's really important. And we are getting a lot of questions about that. Not only are we getting inundated, as you are at the county and the city, with questions around when are we going to get our vaccine? I mean, we would really want this and we want to have it now, and when can we and why can't we, and those kinds of things. We're also getting a lot of questions just around masking. Why do we have to mask if people are getting vaccinated? So it is important to maintain those good practices and really for the next period of time anyway. The vaccine is really not a replacement for those practices. COVID-19, unfortunately, still is prevalent. So we need to take that into account. We continue to recommend also here at Winona Health that those, no different than the Minnesota Department of Health and the CDC, that if a person has had a high-risk exposure or are symptomatic, that they come in and be tested. And we still continue to do about 180 tests a day from our testing process. And so we are serving patients in that way, and certainly still continue to see positivity rates as they are in the county, and all of that factors in. And certainly at Winona Health, we are serving patients from outside of our specific county as well. So our positivity rate internally tends to differ a bit from what the county's rate numbers are. As always, we're here to serve our community. We look forward to our continued partnerships with all of you and working together as we roll out all of this vaccination to the community, and am hopeful that we get more vaccine and more and more and more until everyone that wants vaccination can have vaccination. So thank you.
Yeah, thanks, Sarah, and to Gunderson.
And I'm here, and we'll have Chuck unmute first, and he can open up the conversation. I think if he's not hearing him, I will go ahead and get started. And Chuck Johnson is our administrative director at the Winona Health site. He has the Minnesota and Iowa regions. For those who don't know me, I'm Bridget Paff. I'm an administrative director, and like Sarah, I have the pleasure of having infection control under my purview. So I am also representing our system approach. And for us, we have been very grateful for all of the partnerships with Lindsay and Connor at our facilities, being the leadership team representatives around your tables. And it looks like Chuck is unmuted, so I will let him get started.
I'm sorry, Bridget, can you hear me okay now?
Yes, we have you now.
All right. I apologize for the technical difficulties. I was hoping to be on screen, but my IT department told me that my computer decided to do my Microsoft Outlook update right now. So as luck would have it. So I'm Chuck Johnson. As Bridget said, I am a regional director at Gunderson, responsible for our medical campuses in the states of Minnesota and Iowa. And I'll try to be brief in my comments and be available for any questions that might come up later. So as Bridget mentioned, we have a team here in Winona, primarily our medical campus manager and our pharmacy manager, that have been participating in the regular calls and communicating with others on the team going back almost a year. Our goal as a system is to really take a balanced approach in all of our medical practices, including Winona, where we stay connected to the direction that's coming out of our central campus in La Crosse, but also establish local working relationships and stay closely connected to local partners, including public health and other healthcare systems, to ensure that we are doing our part to meet the local needs and stay informed of Minnesota specific issues, as the issues and the guidance does vary pretty considerably in the 3 different states that we operate in. One example of a system initiative that we've really been encouraging all of our patients to do across all 3 states is to get signed up for MyChart. MyChart is a patient portal at Gunderson, which is what we're going to use as our primary mode of communication to patients as they become eligible for their COVID vaccine. So we've been encouraging patients to get signed up for that as a good way to stay informed of our plans and next steps While we've made connections in each of the counties that we operate in Minnesota, the communication with and the connection to Winona County and the other Winona partners has been frankly among the strongest in our tri-state area. And this has been really important because we recognize as a system that the only way to ensure the community gets the vaccinations that they need is through a collaborative effort. We've done well as a system with vaccinating our own phase 1A staff. In total, we have vaccinated to date around 6,000 staff across our different locations, and we just began with our administration of second doses. We've completed vaccination of our Winona campus staff, and we've been pleased with the number that chose to participate. And our local team here in Winona was vaccinated through a collaborative effort with the county, as well as using some resources on our central campus in La Crosse. To date, we still have not received any vaccine on our Winona Medical Campus. We've submitted all the necessary paperwork, and we're awaiting further direction from MDH and updates related to when we will be receiving vaccine and how much. In the meantime, we're continuing to work with other local leaders and partners to determine what Gunderson can do to best play their part in meeting the needs of the local community and our local patients. We've been encouraging our patients to be patient as we all wait for vaccine supply to improve, and we're hopeful that additional updates and movement will be coming at both the state and federal level in the coming weeks. In the meantime, we've been continuing to develop our own plans. We're reviewing patient criteria. We're developing our own deployment strategy while also closely monitoring the direction that's coming out of all 3 states in which we operate, so that we're ready to go when we are allocated our vaccine supply locally. And I'll close with this. We've come up with some standard talking points that we have kind of become our mantra. We've been sharing this pretty consistently. We've updated our phone systems to include this message. We've put it on our website, and I'll just read through these points quickly and then close. So we're telling patients that we are eager to get them their COVID vaccine, and we know that they're eager to get it. We are working with our community partners, using state and federal guidance to determine who can be vaccinated and when. As soon as the general public is able to receive the vaccine, we are committed to sending updates and information through MyChart, as I explained earlier. And then we've been encouraging folks to go onto our website, gundersonhealth.org/COVID-19 for regular updates and information. Unless Bridget has anything to add, with that, I'll close. And we appreciate being included in today's press conference.
And the only thing I would add is, as a system, just like all of you, working through that message of balancing the ethics, the science, and the implementation together with the available supply and guidance from federal and state officials. And again, appreciative of the partnerships right here in the Winona area to ensure that we have that delivery here. Brian, back to you.
Yeah, thanks everyone. And with this, we'll turn it to a brief round of updates from community leaders. So the main focus of this time together was to hear updates on the vaccine rollout and to hear from healthcare folks. We also just wanted to incorporate kind of some high-level updates from what's happening in the community. I know 1 to 2 minutes is not a lot of time for each of you. If you can just hit the highlights, I'd really appreciate it. You've seen the colors changing behind me, and I'll use that to try and keep folks on time. And I think Chuck did a great job of acknowledging kind of where folks can go for online resources in the future, and that's certainly something available to you too. So, so we'll start with Christy with the chamber, and then we'll move to higher education.
Can you hear me, Brian?
We can. Thanks, Christy.
Good morning. Thanks for having us. I'm Christy Ransom with the Winona Area Chamber of Commerce. And first of all, I'd like to thank the county leaders and our city leaders and our healthcare leaders in the community. They have all worked very hard to keep our community safe and in turn keep our businesses open. And I'm very thankful for that. I've worked with each of those entities and have appreciated the time that I've had working alongside of them. From a business perspective, I just want to say that, you know, as Chief Biddle had already alluded, this has been an extraordinary year. We have almost hit the 1-year mark of where we all began. And it's shown me a couple of things. Number one, that our community is very resilient and our business community is as well. And that's very, very important. Many of our businesses have been on a roller coaster and been hanging by a thread through all of this. And so my update really comes as an ask to our community. Our businesses have been working really hard to follow executive orders and do what's best for our community to keep everyone safe and keep themselves open, which is very important economically. And I just ask that everyone, while this vaccine is rolling out and we have a lot of questions, and I know that there's a lot of people that see so many different sides of this pandemic, that we remain vigilant for the sake of our businesses to keep them open. Please continue to wear your masks and social distance and be respectful to our business owners and their spaces. They work really hard and they've spent a lot of money to keep you safe, and please work hard to keep them open. And then my final ask, and this is going to be really brief, and I've said it many times, you've heard it from the Chamber of Commerce, but keep your dollars local. Support these businesses that support our communities. Make sure that you are being very good about keeping eating local and spending local and shopping local, because they rely on all of us to support them. So thank you very much, Brian, for putting this together, and I will pass it along to the higher ed leaders.
Thanks, Christy, and thanks for starting us off and giving a great model. And so we'll move to higher ed. So in this order, we'll have Scott Olson from Winona State, Larry Lundblad from Minnesota State Southeast, and Tim Gosson from St. Mary's.
Thank you, Brian, for doing this. We are grateful to our partners at MDH, Winona Health, Hy-Vee, Winona County, City of Winona. Thank you for everything you're doing. We've had a commitment all year long to test and track and be truthful about what's happening on campus and be transparent about it. We put up a new dashboard every Wednesday. The dashboard tracks the number of cases on campus, the cumulative cases, the number of quarantines, and the number of isolations. So folks in the media, community members, I would invite you to go look at that dashboard. We update it every Wednesday. Our Count on Me campaign, which was designed to get our students and our campus community into social norming. We're proud that this was borrowed by the Winona Area Public Schools and our friends at the Winona Police Department. So thank you both for jumping on the bandwagon. This spring semester, we've committed to lay low for 2 weeks. That's why I'm here at home. 50% of our classes are online right now. The main exception is labs and clinicals, which we really need to have in person. We canceled spring break. There was no spring break. We didn't want folks to go someplace and then come back bringing whatever with them. That was at the urging of our Student Senate, and I'm very proud of them. And right now we're doing a thing called the hibernation game, where students download like a game board, like a bingo board, and they engage in various safe behaviors that get them points, and the points are in them prizes. And you could Google that and find it as a Winona State University hibernation game. Thank you. Back to you, Brian.
Yeah, and go ahead, Larry, and then Tim, you can jump in right after Larry's finished.
Okay, good morning. Greetings from Minnesota State College Southeast and from Brainerd. It was below zero here this morning, so I'm looking forward to being back in the Banana Belt next week. We have started spring semester. This is our second week, and 60% of our students are off campus, either online or HyFlex, using HyFlex capabilities. About 40% of our students then are on campus, and these students are enrolled in our trade, technical, health careers, and then our music programs in the Red Wing campus. So it's important that we have our students on campus for the hands-on parts of their education. We also have joined the Count on Me campaign that was started by WSU, and so we've been very focused on helping our students, staff, and faculty to stay focused on following the safety protocols. We were fortunate last semester to have a low incidence rate of positive COVID cases, and we're expecting the same this semester as well. We're going to continue with our schedule and have a spring break as scheduled in March, unless conditions change otherwise. caused us to make some changes. We're finding that our students are being very negatively impacted by the pandemic in many ways: loss of part-time jobs, isolation, childcare services that are not available. And so we're reaching out to our students. We've obtained some grants to expand our food pantries. We're connecting with the WSU for mental health services. And we've just added a specialist to connect students with community programs and services. So like all of you, we're hoping that this pandemic is soon over and doing what we can in the meantime to keep everyone safe. And I just really appreciate the good work being done by community health and government leaders and keeping us informed and focused. So thank you.
Thank you, Winona. My name is Tim Gosson, and I serve the university as Vice President for Student Affairs. St. Mary's is truly blessed to be part of the wonderful community of Winona, and we truly want to be your partner. Our students return to the classroom on Monday, January 25th, and our students and faculty will be in person in the classroom. We have asked our students to partake in a soft quarantine for 14 days at home, and we will also ask our students to continue a soft quarantine on campus for the first 2 weeks. We'll administer a mass testing event 7 days upon their return, and we will do weekly surveillance COVID testing throughout the semester. We continue to encourage our students to work on social distancing, mask wearing, hand washing, and reducing the number of personal contacts. And at each of our university entrances, we have signage that indicate our responsibilities do not end on the edge of campus. This is regarding to all of our COVID guidelines. Our residence halls are full and we continue to use our air purification systems. We have isolation and quarantine spaces identified if needed, and we also work with our food service partner Chartwells to ensure our students in these spaces receive 2 hot meals delivered to their door daily. Our COVID dashboard is updated daily, Monday through Friday. That started yesterday, and our breaks have been canceled. So we are encouraging all of our students to stay in Winona all semester, and we have built-in mental health breaks. We have our winter athletes back on campus, and we will be competing this season. They are adhering to all conference and Minnesota Department of Health guidelines, and our students are tested multiple times a week. All students are encouraged to download the Minnesota COVID Aware app to assist with contact tracing. Our student athletes and other student leaders are required to download the app. We continue to work with our student leaders, especially our student senate, to assist with collaboration of all of our COVID guidelines. And the students have a real desire to be in class, be in Winona all semester. That is our goal, and we believe we can achieve it.
Thanks, Scott, and thanks, Larry, and thanks, Tim. And so we'll move now to K-12. So Sister Judy Schaefer with Cotter and Annette Freiheit with Winona Area Public Schools. And then just to note, so then we'll close with Karin and then with Eric. And so Karin and Eric, you're welcome to, Karin, you're welcome to start right after Annette shares her update. So we'll go first to Sister Judy.
Great, thanks very much, Brian. Yes, I'm Sister Judy Schaefer, President at Cotter Schools. And like all of you, I've been very, very grateful. As an independent private school, sometimes it can be a bit isolating, but I've been so grateful to the Winona Health, to my educational colleague, Dr. Freiheit, for including us in all of the weekly conversations. When I was thinking about what this year has been, I was thinking it's really been one long balancing act. Basically, we all are trying to balance the health and safety of our students, our faculty, our staff, with our educational goals, with also the overall health and welfare of our students. Our students have been in various modes of learning this year. Our littlest ones at Main Square Montessori, because it's also a daycare for essential workers, has been open most of the time and providing service. They were ahead of most of us in our system in terms of how to do all of this safely. So we've really leaned on them for input. Our grades 5 through 8 have been in person most of the year, except during the kind of the up spike in November that we all went online. They've really been great about staying in their pods, wearing masks, social distancing. Just every once in a while, I see a couple of those guys out in the playground pulling down their mask. But basically, they're really working hard. They want to be in school, and our teachers want them there. Our 5th through 8th grade returned yesterday, and we hope they'll be there for the rest of the year. Grades 9 through 12 have probably been the most difficult for us because they've really been in some form of distance learning all year. We began with 2 weeks in person so they could get to know their teachers a bit, but they've really been online. We're hoping in the coming month or so to bring them back in person. We've revised their class schedule. We've hired additional teachers. We've even purchased desks, all in an attempt to bring them back. We are really aware of the effect that COVID is having on them. And again, we're grateful to be a part of this collaborative venture. And I especially thank my cohort, Annette. So to you, Annette.
Well, thank you, Sister Judy. And without your guidance too, I would not be as successful as we have been. So thank you very much for your support. I also want to extend a great deal of thanks to all of our county folks. We meet with you guys weekly, and without your guidance, I don't think our decisions would be any easier. So at Winona Area Public Schools, we are in the process of getting our students back into the buildings. We started the school year out in a hybrid for our K-6 students and then distance learning for 7-12. After about a month, we were able to get our 7 through 12 in as a hybrid, and we were in that until that spike happened in November, and we had to shift all of our grade levels to distance learning. So when we returned from winter break on January 4th, our early childhood program started in person. And then the following week on January 11th, we brought our kindergarten and first grade back fully in person, along with our 5th grade. And then our alternative learning center students returned in a hybrid. We are now planning for our grades 6 through 8 and 9 through 12 to return in hybrid on January 27th. We will have some instructional planning days, the 25th and 26th, so we can prep for that. And we are excited to see our students coming back. Our athletics program, our activities all started up on January 4th, following all of the guidance from our state high school league, from the Department of Education, Department of Health, and they started competition on the 14th. Things have been going extremely well. We are also ready to open up our facilities for rental use and you have to go through all the protocols and practices that we expect to maintain it and keep it safe. Throughout this, we've been able to do a tier 1 childcare, and now with our K4, K5 actually all being in person next week, that will be halted until we may have to put it in place if we have to go back to distance learning or hybrid. But at this point, we want to be able to thank everybody who has really helped to support our school district and continue to do that. These aren't easy times, but without your support and the support of our community, it would be a lot harder than it is right now. I want to encourage everybody to continue what everybody else has said with your masks, just social distancing. I also want to support our businesses too, because you've been essential in helping us stay open and be able to serve our students. So thank you to everybody, and stay safe.
Hello, I'm Karen Sonneman, Winona County Attorney, and I'm honored to be with all of our community partners today. As County Attorney, I am sworn to uphold the law. There have been 100+ emergency executive orders issued by Governor Walz during COVID. These are the law during our peacetime state of emergency. One of those orders is 2081. It requires all Minnesotans to wear a face covering in certain settings to prevent the spread of COVID-19. It remains in effect, and it carries with it criminal and civil penalties for violations of the order. But I take to heart Governor Walz's urging all Minnesotans to voluntarily comply with the executive orders. My office is part of our county COVID team. We work together with the Minnesota Attorney General's office to monitor and enforce compliance with the executive orders. We work together, as we are here today, to encourage voluntary compliance. Our first step to encourage compliance is to provide education. Law enforcement and the fire departments have taken on that education role. For that, I thank them so much. They have been very successful to help individuals and businesses understand the importance of wearing masks, practicing social distancing, and complying with venue and other operating restrictions during COVID. The next step when education doesn't work is to provide formal notice to the violator and again, encourage voluntary compliance. When that doesn't work, the next step is formal enforcement, either on a criminal or civil basis. We have not had to resort to that third step in Winona County, and for that, I am grateful to the residents of Winona County, both business owners and citizens, for stepping up and complying to help each other in this crisis. Keep up the good work regarding compliance because our health and our lives during COVID depend on that. These public health measures are small inconveniences, but they are still critical to follow. We are in this together. Thank you, and I'll turn it over to Eric.
Morning, and thanks, Karen. My name is Eric Sievers. I'm the Executive Director at Hiawatha Valley Mental Health Center. A few quick updates of community mental health in the Winona area. The biggest thing to share with the community is that since the pandemic became a big reality for us, we've continued to remain open. So we have not had one day where we have been closed for services, and we continue to be open today. The big change, obviously, is the way we've met the need has really changed. And so today, every service we provide, with the exception of our residential programs that we have to provide in person, we provide our services in person through telemed, a lot more than we did before. And so that was a big thing I wanted to be clear, is that we are a resource for the community today, like we were before the pandemic, and we will be in the future. The two big things that I wanted to make sure were clear is that we have a mobile crisis program 24/7, 365 days a week for kids and adults. That number is 844-274-7472. That's been a service that's been there for the last year. It's there today for anyone that is in a mental health crisis and needs help immediately. That's a resource for the community. The other thing, which thanks to Solomon's song, we started last spring. It was an opportunity that we saw with COVID to provide monthly webinars. And so on our agency website, hvmhc.org, there's webinars that we provide each month. The old ones are there, and we have one offered next Tuesday. So mobile crisis and webinars are quick, easy access things that we have along with our traditional services that we've always done. So thank you, and I'll give it back to you, Brian.
Yeah, thanks, Eric and Karen, and thanks everyone. A moment of appreciation that we heard, updates from just about 20 folks representing more than a dozen community institutions and organizations in about 45 minutes. So I'm so appreciative for everybody to just to hang with that. What I'd like to do at this point is we'll take questions from media. We had invited folks to have about 15 minutes of time, so I'm hoping folks can stay till maybe no later than 11:10, about 10 minutes after the hour if we need that long, and then invite folks to connect directly afterward. We did have one question in the chat I'll start with, probably for the county, which is what are the recommendations for Winonans who are now able to possibly get a COVID vaccine following yesterday's announcement from the state?
Hi, this is Melanie from Winona County Health and Human Services. I can answer that question. So we are asking Winona County residents to be patient. There is limited vaccine availability. We are waiting to hear more from the Minnesota Department of Health and the federal level of when we will receive more vaccine and the future guidance for the future phases. I can promise you that once we have additional vaccine, Winona County is ready to continue vaccinating our county residents. Currently, we're in Winona County, we're in phase 1A, second priority, moving to phase 1A, third priority. Per Minnesota Department of Health's guidance, we are to finish up phase 1A, and then as vaccine comes available, move into vaccinating the over 65 population. We ask you again to be patient. All of the information and updates will be on the Winona County COVID-19 website. We'll have a press release when we are ready to vaccinate the over 65 population. And there is also a newsletter that is listed in the chat where you can sign up to also receive additional updates.
Thanks, Melanie. And it looks like another question here now from Chris in the Winona Post. A question for Melanie or Karen. The question is, when are you starting vaccination of phase 1A third priority?
I can speak to that question too. So this week, we are hoping to continue to move through phase 1A, second priority, which is the assisted livings and home health care agencies. We're really waiting on additional vaccine. So depending on when we get that additional vaccine, we could be starting phase 1A, third priority, well, as soon as we have that vaccine in our hands. But it could possibly be the beginning of February, mid-February. It's all dependent on when we receive that vaccine.
Thanks, Melanie. So other questions. So media, you're welcome to either unmute or ask your question live or to put it in the chat. I'm not seeing anything in the queue unless I missed something. So we'll just kind of hold some space for folks if you wanted to either unmute or put something in the chat. And here's a question. How much, probably again for the county, how much advance notice do you get before vaccine arrives?
Yeah, so I can sort of explain the vaccine process and how it gets to the great state of Minnesota. So all of the vaccine is distributed to the states on a federal level. Once the Minnesota Department of Health receives the vaccine, there is an equation that they use to determine the amount of vaccine that the counties receive. So that equation includes the population size of the county, the data that Winona County is sending to the Minnesota Department of Health of the number of individuals we have in those phases. As of right now, since we are in phase 1A, second priority, the allocation that the state of Minnesota receives, which is approximately 30,000 doses each week, has been reallocated to the pharmacy program to aid in the vaccination efforts for our assisted living and skilled nursing facilities. So once we receive more, I can tell you that we are receiving our second doses. We are planning to wrap up with our second dose vaccines for the first group that we vaccinated, and we're waiting on the Minnesota Department of Health and the federal level to release more vaccine. So we get about a day notice to ask your question. Typically they'll say, Winona County, you're receiving this much, do you accept it? We've accepted all vaccine that's been offered to us, and then we implement it as soon as the next day. And the goal for all of the counties in the state is to have the vaccine in people's arms within a week.
Thanks, Melanie. How about any other questions? Either unmute and ask live or just put them in the chat.
I've got a question for Sarah at Winona Health, if I could.
Yeah, go ahead, Chris.
Sarah, have you been able to start any phase 1A third priority healthcare staff at Winona Health?
We have not to date. However, we are working on that plan to do that starting later yet this week. Now, we have very limited supply. So as Melanie said, it is so dependent on getting more vaccine. So we are in our second dose of our Pfizer vaccine, okay, for our employees. And those that were in that priority 1A, 1 and 2 groups. So, you know, yesterday we took some time to just see how many doses are we going to have left of first and second doses in that Pfizer vaccine. And it's a very low number. So we do want to use it though, and we'd like to get that used this week. So I have reached out to Ben, and he and I were working a little bit on what would be that next group. And so more to come on that.
Thank you.
Thanks, Chris and Sarah. And we have a question in the chat, and this is maybe for Scott or if Steve, the city managers and council, this live, and if not, we can respond later today. The question is the city considering measures similar to last year in terms of fees and relaxing ordinances for establishments impacted by closures or reductions in service?
Hi, Brian, I can take that. And maybe Steve can chime in on it as well. But of course, we're always looking at the impacts that the pandemic has, not only on our local businesses, but also the public. And in regards to some of the services and fees, we will be looking at those again. But I don't know that we've made any determination on anything yet. Steve?
Brian, if I could, also, some of this is going to depend on what the federal and state government do with respect to additional aid to the cities. So if another package comes down, we'll certainly look as to how we can further impact the community and help out wherever possible.
Thanks, Scott and Steve. We have time for maybe another question or two before we close, either in the chat or just by unmuting and asking it live. And a special thank you to Violet with Winona County Emergency Management, who's been responding to questions live, both on the county's Facebook page and on the city's Facebook page. We otherwise haven't had direct questions there, but I think just as folks who are watching this live to know, we're going to post an update that hits some of the highlights of this news conference later today. And then the video will also be available to watch. So at this point, we're at 5 after 11. I'll just give one last call for media for any questions, either live or typed into the chat.
I've got one more question for Melanie or Karen, if I may.
Yeah, go ahead, Chris.
I know you guys talk a lot with the state and the MDH. Have you heard anything about them considering opening, they just opened these pilot sites, one in Rochester for folks over 65 with really limited doses available, but have you heard anything about future plans to have something closer to Winona?
Sure, I can answer that, Chris. They are looking at, so we have our semi-permanent testing site that is in Winona and currently operational as a testing site. They are looking at potentially doing that as a community vaccination site. We haven't received much, and that's been announced across the state of Minnesota. So they are considering doing a community vaccination site here in Winona. So, but we don't have as much information on that. I just missed a meeting on it because I was on the press conference. So I will be looking for more updates on that.
Yeah.
So with that, we'll close this morning's live news conference. Just to offer really deep appreciation for all of the community leaders and for everyone who is here today, for all of the media working just as tirelessly to get the word out and sharing updates with the community. Just to mention a few going forward steps. So we will have an update on some of the highlights that were mentioned today, posted on the City of Winona COVID-19 page and hopefully shared by others later today. This video will be available almost immediately after this broadcast on our Facebook page, and then will be uploaded in a higher res version to YouTube and places for folks who don't use Facebook. And I'll be sharing that out with everybody who participated today. So thank you again for your time, for your energy, for your commitment to keeping the community safe, and for doing all this really good work on everyone's behalf. Appreciate everybody being here today, and thank you and enjoy the rest of the day.